Hello and welcome. Today, we're focusing on LO2, understanding the internal and external environments of health and social care organizations. We'll explore how factors like culture, society, and policy shape healthcare delivery and influence services. Cultural and religious beliefs play a significant role in healthcare. Education and class structure influence access to health services. Social priorities can dictate healthcare funding and policies. Attitudes towards health interventions vary across regions. Understanding these influences is crucial for effective healthcare delivery. National priorities often contrast with local cultural needs. Demographic factors shape healthcare demands. Morbidity and mortality rates influence health policies. Regional variations require tailored healthcare strategies. National policies must align with local healthcare needs. Internal factors include the organizational culture and leadership styles. Quality control processes ensure effective healthcare delivery. Resources like staff training impact service quality. The chain of command influences decision-making. Internal environments are vital for patient care. External factors include ownership and governance structures. Regulations shape healthcare delivery. Innovative technology attracts healthcare professionals. External factors determine service range and quality. They are crucial for strategic healthcare planning. Assessing internal and external factors helps understand their impact. Ownership affects resource access and governance. Financial health influences organizational sustainability. The extent of services impacts care quality. Stakeholder demographics shape healthcare demands. Environmental analysis ensures sustainability and growth. External analysis identifies market trends and risks. Internal analysis optimizes resources and identifies weaknesses. Together, they provide a comprehensive view. Strategic planning relies on thorough environmental analysis. Identifying strengths enhances competitive advantage. Weaknesses highlight areas for improvement. Strategic actions are based on these analyses. In healthcare, strengths can attract more patients. Addressing weaknesses ensures growth and sustainability. Experienced staff offer specialized care programs. Modern facilities enhance marketing appeal. Comprehensive care programs attract diverse residents. Positive reputation boosts online presence. Addressing weaknesses like limited capacity is crucial. Early intervention programs prevent severe conditions. Training for professionals ensures early detection. Integrating mental and physical health services offers holistic care. Increased funding improves service quality. Community-based care reduces stigma. Regular training improves detection of mental health issues. Primary care providers play a key role. Proper training reduces burden on specialized services. It ensures comprehensive patient care. Training is crucial for effective healthcare. Combining mental and physical health services is essential. It addresses stigma associated with mental health. Patients receive comprehensive care. Recognizing the interplay between physical and mental health is vital. Integration improves patient outcomes. Increased funding enhances mental health services. It reduces wait times and improves quality. More resources mean better patient outcomes. Funding ensures sufficient professionals and clinics. Financial support is critical for effective care. Community-based care is more effective than institutional care. It reduces stigma and supports integration. Individuals remain connected to their communities. Social support enhances recovery. Community care is essential for mental health. Campaigns educate the public about mental health. They reduce stigma and promote services. Awareness encourages early help seeking. Public perceptions change through education. Campaigns are vital for mental health advocacy. Policies protect against discrimination in workplaces. Legal protections ensure access to care. They promote an inclusive society. Individuals can seek care without fear. Legal measures support mental health integration. Internal and external analyses shape healthcare strategies. They provide insights for informed decision-making. By understanding these environments, healthcare organizations ensure sustainability and growth. For further questions, please contact us on WhatsApp at 07-484-361688. Thank you for listening. We'll see you at the next session.